All right, well, welcome everybody to the February webinar hosted by F.E.A.S.T. We've got a couple just housekeeping items here. Thank you for joining us today. If everyone could stay muted with the camera off during the presentation. And if you have questions when we hit the Q&A section, you can just put them in the chat box. And when we hit that part of the seminar, we'll read those back and see whatever questions folks have. So those are just a few little housekeeping things. I'll probably continue to admit some folks throughout the time as the webinar goes along. Today we have a great speaker. We've got Carine Khazan. She's coming to us from the UAE, and I'm going to go ahead and turn everything over to Carine and let her do a little intro and then get into her presentation. So I will stop sharing, Carine, if you want to take it over. Hopefully you can.
Yes. Thank you, Ellen. Thank you, F.E.A.S.T, for inviting me to talk about this, I think, very important topic, specifically when you are caring for someone with an eating disorder. So my name is Carine Khazan. I am a clinical psychologist. I specialize in the treatment of eating disorders. I am the director and the founder of the only multidisciplinary and specialized eating disorder program in the region. I am based in Dubai, the UAE. And I'm also the vice president of MIDA, the Middle East Eating Disorders Association, which aims to raise awareness in the region on the subjects of eating disorders and support sufferers. I am a fellow of the Academy for Eating Disorders, and I have co-authored a book with Dr. Ricardo Dallegrave on how, basically a parent's guide for teenagers that have eating disorders and are, in treatment with CBTE. So the book is called Cognitive Behavioral Therapy for Eating Disorders for young ones and for young people, and a parent's guide. So the bulk of my patients are teenagers, though I work also with adults. But since the pandemic, we've seen really a rise in the number of teenagers struggling with eating disorders. And I have a lot of experience dealing with families, and we believe they have a strong and a very important role, specifically during these very sensitive times, which Ramadan is one of them. So the first disclaimer is that I am not of Muslim faith, but I have studied the Holy Quran, and I do work in collaboration with eating disorder practitioners of Muslim faith. And I have worked in a Muslim country for the last 18 years, treating Muslim sufferers struggling with eating disorders. So I'm very familiar with the faith, the religion, and with individuals of Muslim faith who do have eating disorders. That's our outline. Okay, so let's start with what is Ramadan. Ramadan is one of the main pillars of Islam, and Ramadan involves fasting. They are required to fast, fast as in abstain from food and drink, sexual activity, and smoking from dusk till dawn, basically. And they will break their fast after sunset, and they can eat during the night. And they should eat during the night, actually. And at the end of the month of Ramadan, there's a big celebration, which is called Eid al-Fitr, which basically, if we can compare it to Christmas for people of Christian faith. So it's a big celebration, lots of food, gifts, and you buy a nice dress, and so it's a big thing. It is widely considered as the most important date of the Islamic calendar, and it is a very spiritual month. So it is not only a month where you fast, but it is a month where you, practice becoming a better Muslim. The two main meals during Ramadan are futur and iftar, and they're taken, as I said, between sunset and sunrise. So basically, you break your fast when the sun sets with futur, and in the middle of the night you wake up and you have suhoor, which is around 3-4 a.m. before the sun rises again. And you can consider this as dinner and breakfast. In between, you are not eating or drinking between 17 to 19 hours, depending on where you're living. And usually, typically, futur is a kind of, I like to call it an organized binge. So it involves a lot of food. Food is presented in a specific order. So you break your fast with water, then you have dates, then you have laban, which is like a kind of milky drink. Then you go, you pray, and then you eat the main meal. The main meal involves appetizers, and then 1 or 2 main courses, and then a lot of desserts. And some of them eat throughout until they sleep, and then wake up and eat again their suhoor before sleeping again, and again abstaining from food from sunrise to sunset. It is not an easy month. A lot of not a lot of sufferers, a lot of Muslims will sleep later during the day to minimize the hours where they are fasting, and will sleep very late, basically to be able to eat more before the sun rises again. So there is a very important surah in the Quran that very clearly and explicitly exempts from fasting those who are ill, pregnant, or breastfeeding, okay? And children are not required to participate. This is very clearly stated, and this is accepted by the Muslim community. Fasting during the Ramadan for eating disorder sufferers is a very, very sensitive time. There is an opportunity to mask an eating disorder with, conceal it with the mask of faith and dedication to faith. You can basically starve in peace, and not only in peace, but by being, praised by your environment and your family. For those who are recovered and who are not masking their eating disorders with fasting and with Ramadan, it is a huge challenge, because it can trigger the eating disorder mindset and really presents a huge risk factor for relapse. Whether anorexia, individuals suffering from anorexia, or individual sufferers suffering from bulimia, binge eating. So the first thing that we have to bear in mind is that the intention, if you do not have the intention to practice your faith in a better way and be a better Muslim, and really feel with the sufferers, with the individuals that are unprivileged and do not have access to food the way we do, it's a way to feel with them. So it's a way to be connected with the suffering of others. It is not a way to lose weight. It is not, to detox your body. It is really to be in a state where you are able to pray more, and a state where you are feeling with others. And as a result, you should feel more grateful for what you have, okay? And the problem with eating disorders is that it skews the mindset away from faith, and unfortunately, fasting facilitates eating disorder behaviors. Again, sufferers who are undiagnosed or who are diagnosed, but, encouraged, or their families accept that they fast, can easily lose weight, cut off food, and are not detected. And we see a lot of eating disorders that actually get triggered during Ramadan, because, as you know, if you have personalities which are predisposed to developing an eating disorder, any period of food restriction, weight loss can trigger an eating disorder mindset. So these are some quotes from sufferers who basically admitted using Ramadan to hide their eating disorder. So every year I used to wait for Ramadan thinking I can lose weight. For sufferers who were under scrutiny, it's a way basically to hide away from their family scrutiny, and basically starve in peace without arousing any suspicion. And the question is really that we need to ask ourselves when we are deciding if sufferer can or cannot fast, are they really fasting for God, or is there a will to fast for God, or is it really part of the eating disorder mindset? And even if they are fasting for God, are they ready to mentally and physically to go through this without triggering an activation of the eating disorder mindset? So the sufferer fasted, even though her family was against it, her treatment team was against it. But because, we are in a very religious country, it is also difficult for families to say no. And as a treatment team, even though we spoke with the religious authorities, we are very limited in how much we can recommend, exemption from fasting. So this person, went ahead and did fast, and as a result, she ended up in the hospital. So what are the effects on an eating disorder? Of course, in someone who is recovering from an eating disorder, if you think about anorexia nervosa, it's a clear obstacle to weight restoration, because typically individuals who don't have eating disorders will overcompensate and will eat a lot between sunset to sunrise. And most of individuals who don't suffer from eating disorders will gain weight, not lose weight. However, someone who is recovering from anorexia, this is not what we see. They do, lose weight because they are not at the point where they, listen to their bodies if they ever can, and they will, eat less, and they will not compensate during the periods of eating, and they might relapse. Also, we know from a clinical perspective, and also research has proven that any weight loss in individuals who have anorexia or have had anorexia, I mean individuals who are actively anorexic, though they are engaged in the process of recovery, and those who are actively anorexic, any weight loss can, activate the eating disorder mindset. And when we're treating binge eating disorder and bulimia, one of the cornerstones of treatment, and I am a CBTE practitioner and trainer, etc. So the cornerstone is something called regular eating, also for anorexia, but specifically for binge eating. So when you are fasting, there is no way that you can basically establish regular eating. So what happens and what we see is that they fast during the day. I'm talking about binge eaters and bulimics, and then are going to binge when they break their fast. And those who suffer from bulimia are going typically to feel guilty and, use compensatory behavior, self-induced vomiting, etc. So we see a lot of eating disorders triggered. So individuals who have not had a history of eating disorder can very easily develop an eating disorder during Ramadan, as I said, because weight loss and food restriction can trigger an eating disorder mindset in anorexia, and because you have a tendency to, when exposed to food after restricting, if you have this predisposition to binge, and you can develop a binge eating disorder. So it is a tricky time, even for individuals who don't have a history. So it is tricky, but clearly for individuals who don't have a history, we definitely cannot recommend exemption from fasting. Anyhow, they're not in treatment. But just to say that it's also a tricky period in general. So there are medical complications for individuals who have eating disorders. So for anorexia, we can see dehydration, low glucose level, low blood pressure, electrolyte imbalance, cardiac arrhythmia. We have sufferers who have had like fainting episodes, have had to go to ER. So this is why specifically the Surah in the Quran exempts from fasting individuals who are ill, because for anyone who goes without food and eating between 16 to 19 hours, if you are ill, you are going for sure to, develop even more serious medical complications. So it is there for a reason. If you look at bulimia and binge eating disorder, you are at a higher risk of developing type 2 diabetes when you fast and then you break your fast. because of the, fluctuation of the blood sugar. So when do we not fast? As I said earlier, in Islam, Allah has given permission to people who are ill not to fast. Okay, it is very clear. But the problem is that the type of illness is not specified. So they don't mention what type of illness, qualifies for an exemption from fasting. And this is the tricky, part, because it's not written, black on white, what criteria you need to have to be exempt from fasting. And this is why we face a lot of obstacles when recommending to, basically not fast, because specifically eating disorders, specifically for an uneducated population, for most of them does not fall into the ill category. But what we say typically is that the treatment team, if patients, if sufferers are in treatment, it is really the decision or the recommendation has to come from the treatment team and not from the family. And even if physically patients are well, so typically individuals with anorexia who have recovered normal body weight, even their genetic set weight, but are still not there, psychologically, mentally, even though they are physically healthy, psychologically, they're not there yet. They're not psychologically healthy. So also those should be exempt from fasting. But unfortunately, individuals and their families look at the medical side more than at the psychological side. And this is why we have had, this is a very common argument that, but she's at a normal weight, and she has her period, and she's medically fit to fast. Fine, she's medically fit to fast from a medical perspective, but from a psychological and from a mental health perspective, she may not be. So we, because we've been facing this for many, many years, we have contacted Dar al-F.E.A.S.T, which is a very high Islamic religious authority, and we did explain in length the health issues that are, related to eating disorders, the health and the mental health issues. And they have confirmed that this category of patients are exempt from fasting, and they should basically engage in other religious activities to compensate for the act of not fasting. But the line is still blurry because the main criteria remains the medical aspect. We do advise our patients, because it's a very big responsibility to basically, have this recommend not to fast. We do advise them to take it if patients are resistant, or if the families are resistant, to take it to their religious authority. If they are in a healthy body, the religious authority might say that they are fit to fast, even though mentally they're not. So that is the tricky part. So if patients can fast, or who can fast, okay? Because that's also the question. Can I ever fast? When can I fast? Because in Islam, if you don't fast for any type of reasons, for example, if women have their periods, if they are breastfeeding, or if you have the flu, or let's say COVID, you're exempted from fasting, but you are required to compensate for those days after. So for example, whenever after Ramadan, you will count the number of days that you haven't fasted, and you're required to fast them later. So this is a question that comes also back very frequently. I mean, can I compensate when I'm better? Can I fast? And basically, if for fully recovered individuals that have had a history of binge eating disorder and bulimia nervosa and are fully recovered, have gone through their treatment, have been followed up, and are really got rid of the eating disorder mindset, they can. And it is also possible with a very specific dietary guidance for binge eating more than for bulimia, to attempt fasting when they are in the last stages of their recovery, but they have to follow very, very clear dietary guidance. We believe, and this is not evidence-based, but this is based on many years of clinical work with this population, that fasting is never indicated for individuals who have a history of anorexia nervosa, even if they are fully recovered, because we know too well that any weight loss in the future, even after recovery, can trigger a reactivation of the eating disorder mindset. So, you know, that's the short answer. For individuals with anorexia, we tend to say, you know, possibly never, because as you know, and as we've seen throughout the years, even not because of Ramadan, but because of other reasons, some patients recover from anorexia, develop clinical depression, for example, after a couple of years, lose weight, and then you see a reactivation of the eating disorder mindset. That's why we recommend not. However, for those who attempt fasting, it is very important to make it clear that fasting should be stopped immediately if they notice a relapse, whether it is a physical relapse. So, for example, with anorexia, weight loss, even if it's not intentional, that means that they're not able to have enough food intake, and this can, you know, trigger the ED mindset. And those who do not lose weight but notice, you know, some of the mindset coming back, for both those cases, so whether there is weight loss, whether it's intentional or not, or there is a reactivation of the eating disorder mindset, even if the weight remains stable, we recommend to stop fasting immediately. So let's say our patients are recovered, or are binge eaters, and individuals suffering from bulimia, or are at the last stages of their recovery, have been doing well for some time. How can they fast? How can they attempt fasting? So people must break their fast with water and food exactly after Al-Maghrib announcement. The Al-Maghrib announcement is when, you know, it's the call for prayer, when the sun sets, and this is when basically you break your fast and you have iftar. And we establish regular eating during those eating periods. So we try to advise for them to eat every 3 to 4 hours, and to definitely not skip the suhoor at least, which is kind of the breakfast. And we try to recommend even waking up before to have more meals. So the more they can eat in a regular way, the better they can, you know, sustain their fast and not develop binge eating. It is important to pre-plan meals ahead, and also not to deprive themselves from anything, because for binge eaters, of course, if they don't allow themselves to eat desserts and sweets that they are exposed to, we see a bigger risk of binge eating. But it is very difficult, okay? So we have to remember it's a pillar of Islam. So a lot of them feel guilty. Those who are recovered and do feel better and do feel that they could attempt and are not hiding their eating disorder under the false pretenses of religion, will feel very guilty. You know, they are going to feel that they are bad Muslims, that their sins won't be redeemed, and that their wishes won't come true. So they are going to feel very guilty. The biggest problem, in my opinion, is the big social stigma, because we are able to convince our patients, we psychoeducate, and a lot of them can be convinced, those who are really engaged in the process of recovery, not to fast. However, they are very afraid of others' judgment. It's extremely, you know, shamed, not fasting for a Muslim during Ramadan. I mean, these individuals are shamed. It is really, they're judged, and it's very it's criticized, commented upon, etc. And the other fear is to miss out on those, you know, rituals and celebrations around Ramadan. So, for example, iftar is really a moment where you invite people over, or you might go to other people's, and it's basically a dinner invitation, and people socialize and people interact, and then there's a specific prayer that has to be, you know, done before breaking your fast, or no, when you just have broken your fast. So after the first, the water, the date, and the laban. So it's a whole thing as a community. The first line community, and then the larger community. So there is a formal kind of feeling, and as I said, they are very much afraid to be rejected from their communities if they don't fast. We have bigger problems also. If you take a step back and you look at the community as a whole, there is this common misconception that eating disorders are Western problems, and we don't see them in the Middle East, and it's not a Muslim problem. It's swag, the single white affluent rich girl only has eating disorders. So they might not understand the concept of eating disorders, and those who do, most of them are uneducated on the topics of eating disorders and do not understand the medical complications, the psychological and the medical complications, don't understand the severity of an eating disorder, don't understand that eating disorders are the deadliest of all mental health disorders. So they don't believe that it is a legitimate medical issue that warrants being exempted from fasting. So these are all our unfortunate obstacles that we struggle with. We work a lot with families, and I'll spend some time, in a couple of minutes, to explain in detail what we can do. But really, they are key, because if our sufferers are convinced, the next obstacle will be the family. And if they're not convinced, our hope for them not to fast is to educate families and to hope that families will encourage them not to fast. So again, just a reminder, Ramadan is a holy month. It is believed that if you fast during Ramadan, you are going to be exempted from all your sins and your wishes will come true. So eating disorder sufferers, even those who are not recovered and have a part of them that uses Ramadan to cover up their eating disorder, but there's still this fear of not being a good Muslim, of being punished by God if they don't fast. So this is also there, even for those who are using Ramadan to cover up or to have peace from their families when they are engaging in their eating disorder behavior. So, and of course, this applies to practicing Muslims. Those who do not, practice their faith, we don't have a problem because they typically will not attempt fasting. So as I said, the social stigma is big, and people start to question, why aren't you fasting? Did you try and you couldn't? Or, asking questions about how fasting is going, and, doing some very triggering comments, that your younger cousin can fast, why can't you fast? So people really, feel inadequate and like failures. Even though they haven't attempted fasting, they just decided to fast because they have a serious condition and because their treatment team has recommended not fasting, because the religious authority has approved them not fasting, because the families are on, and even if the families are on board, the community and the external circle can be very mean, and this can be very difficult to handle and triggering. So thankfully, in our treatments, we get, some individuals to realize that, Ramadan and fasting is a religious act, and the intention is key. So if there's 1% of them who is doing it to cover up for their eating or justify their weight loss, they even if they recognize that, they can decide not to fast. And it can come from them, even if they're not fully recovered. So not everyone will want to, jump into fasting to be able to lose weight in peace. But these are usually individuals who are engaged in treatment and already motivated to recover. So as I said, families, in my opinion, families are the biggest obstacle, because I think that in therapy we are, pretty good at explaining the dangers and at, motivating our patients to want to get better. And most of them, specifically if they are engaged in the process of therapy and have been engaged for a certain time, will accept quite easily not to fast. Some of them will not want to fast because they understand that the purpose of fasting is to be closer to God and to feel with the underprivileged and not to lose weight. So they will themselves come forward and tell you, I'm okay not to fast. But families are specifically in my country, I mean, I'm not from the UAE, but this is where I live. In this country, it is families are extremely uneducated on mental health in general and eating disorders in particular. So a lot of the families, despite how much we educate, do not understand the severity and lethality of those disorders. Those who know that their kids have eating disorders or their loved ones think that it's not a serious mental health condition. It's just eating, go eat, don't eat, And some of them are undiagnosed. I mean, in the UAE and I would say in the Middle East, we have a lot of undiagnosed eating disorder sufferers because of the lack of awareness that comes from family. They don't know, they're not educated on the topic. So imagine someone who has already developed an eating disorder, who is fasting with their family. So, the exacerbation of the eating disorder behavior is going to be, unfortunately, extremely fast and detrimental. And, this is going to be a big obstacle. I have had sufferers, patients who have begged their families not to fast, so to allow them not to fast, and the families have refused. So, we do what we can. So what do we do with these families? We educate, we highlight the medical part, because this is what they understand the best, more than the psychological aspect. We enroll our medical doctor to do extensive psychoeducation on the medical, consequences of fasting for these individuals. And we remind them, the families, over and over again, that there are alternatives to fasting. So if an individual is ill or unable to fast, or old, so the elderly are also exempt from fasting. There are other ways to practice your faith during Ramadan, so it is not the only way. And if all fails, so if the family does not accept and does not allow their loved ones not to fast, because we are in this type of family dynamic. So specifically teenagers, if the parents are not going to allow them to be exempt from fasting, they have no other choice. So we try to work with them, with our dietitians, on how to fast in the safest way possible. So families can be enrolled, can be of support, not all of them, but some of them, and they do have a crucial role, okay? So when their loved one is struggling with this whole idea of fasting, not fasting, they have to remind them that EDs are very serious medical conditions, that as a consequence, they are fully exempt from fasting on medical grounds. So they are not going to be punished for not fasting. They will not, their sins are not going to accumulate, and their wishes can come true because they have a specific and valid reason not to fast. And on the contrary, if we're looking to practice our faith and to be a better Muslim, using God as an excuse to lose weight and to practice eating disorder behavior is definitely, achieving the opposite. families also have to remind them that there will be other acts of worship that they can participate in. And again, they will achieve the same result from a religious perspective. So they will have their wishes come true and their sins will be exempted, etc. So fasting is not the only way to practice your religion during Ramadan. And it's very important to remind your loved one that even if they're not fasting, they will and they should participate in all gatherings, because otherwise they feel left out, they feel excluded from the community. So they will be there for iftar, they will break they will eat, like their fasting family, they will eat at sunset, and they can eat the dates and the water and the laban, and they can go pray with their families. And then, and suhoor, they can wake up and have breakfast with them. All of this is achievable. They do not need to be excluded. So they feel that they are part of this month and participating in all ways. And of course, during Eid, they are entitled to the same amount of gifts and celebration than those fasting. And also, I think it's important that if you are part of a community that is judgmental, which will be the case, this can be confidential. So people do not need to know that they are not fasting. So for example, if you're having people over for iftar, they don't need to know that the teenager or the young adult or the husband or the wife have not been fasting because they have some mental health problems. They don't need to know, and the sufferer will have exactly the same rituals as the family and those fasting. In case the outer community knows, or the second circle knows, and if in case they do pressure, it's important to protect your loved one from the pressure and express your support for their decision. Also, it is very important to encourage them to have meals when the family is fasting. So preparing the meals, having the meals ready, because it's easy to say, no, you should not fast, but then there's no food available, or the mom is sleeping the whole day, or the carer is not there because they are fasting, so they are sleeping. So if it's a teenager or a young adult that's not independent, then this is going to be problematic. So it's important to provide food and to encourage regular eating during the periods where the rest of the family is fasting. And again, it's very important to have the sufferer, despite the fact that they have eaten during the day, participate in those important meals, which are iftar and suhoor. The other part is really to help and brainstorm with the loved one on alternatives to fasting, so that they don't feel guilty and that they feel that they are practicing their religion the way they should. So we encourage them to give to charity, to read the Quran, feed others. I'll go into details about the alternatives to fasting. If someone is struggling with fasting, which is common, it is unwise to express that in front of the sufferer who is not fasting, because part of Ramadan is to struggle, okay, and to feel how difficult it is to resist the temptation. So if someone is telling you that they are struggling and you are not struggling because you are eating, then you feel even more guilty. And definitely don't equate Ramadan to weight loss, which some people do, not the majority, but in our fitness obsessed, fat phobic society, a lot of people who do not have eating disorders will try to use Ramadan also to lose weight. Most of them don't succeed. If anything, they gain weight. It's important to also remind that there is a possibility, especially for binge eaters, to compensate for fasting at later stages of their recovery, when they're completely out of the disorder, if of course their healthcare providers feel that they are physically and mentally ready to do so. So what can we do if we don't fast? You can donate money and food. This is the first one. Give to charity and show small acts of kindness to people around you. You recite more Quran. You read books on Islam to increase your knowledge of Islam. Of course, you pray more and spending time helping and serving others. So, I mean, if you do a couple of those, you are basically, you know, fully living this month as someone who is fasting, and you are, you know, being a good Muslim. And I'm done. This is the surat from the Quran that exempts individuals who are ill, elderly, breastfeeding, or adolescents to fast. And I'm done.
Thank you, Carine. That was wonderful. I really appreciate you taking the time to cover this really important topic for us. So I just want to close out and saying, you know, just to remind folks that, you know, F.E.A.S.T is a nonprofit. We rely on the generosity of our community to have our operations and hold webinars like this. If you're interested in donating, you can just go to our website and there's a donation thing right on the very first page. And really quickly, our next two webinars are going to be, one is going to be what is fat phobia and how it can affect your loved one's recovery. Presented on March 22nd. And then the one after that is going to be on April 19th. And it's basically going to be tips for researching and understanding data on eating disorders. Let's see, we have some, oh yeah, we got a couple messages saying, thank you so much for Carine. That was really interesting. So we really appreciate everything that you spent time putting this together.
It was a pleasure. I'm going to put my email in case you have additional questions, or if anyone has additional questions, please do not hesitate to email me.
Great. Thank you very much, Carine. We appreciate you spending the time.
You're welcome. You're welcome. It was a very interesting topic for me to put all my thoughts together.
Yes, and we will be sharing this. This will be up on our library so people can access it in the future. I think this will be a great resource for people to be able to take a look at. So
great. Thank you. I've enjoyed it.
All right. Take care. Thank you, everybody, for
attending.
Take care.
Bye.